and we tell women's stories. We interview women from all over the world to hear their journeys, how they got to where they are today, to be role models and mentors for others. And I'm really excited to talk to Lauren Waterman today. Lauren, welcome to She Can. You're a consultant psychiatrist at Camden and Islington NHS Foundation Trust. You're also an editor of the British Journal of Psychiatry Bulletin journal. You are a member of the RC Psych Working Group for the Health of Asylum Seekers and Refugees. You're a charity volunteer and a campaigner for improving access to health and social care for migrants. Your particular expertise is in assessing and treating insomnia, anxiety disorders, OCD, mood disorders, and trauma-related disorders. So tell us a little bit more about yourself, Lauren, and how you got to this place.
Sure. So I guess when I was a teenager growing up, I always enjoyed talking to people about their problems, and I felt like I wanted to go into kind of a caring profession. And I was also interested in science, so medicine and particularly psychiatry sparked my interest. Getting into medical school was not very easy. In the end, I managed to get into one out of the 4 medical schools I applied for, but you only need one. I know many great doctors who had to apply many times. So, you know, I guess for people aspiring to do this, don't let that deter you. And then I went to Imperial College London to study medicine. I also did a year in psychology at King's in London and King's College London. And then I graduated as a doctor. I did the 2 years rotating around different specialities as we have to do, like our residency, as they call it in the States, or junior doctors in the UK. And then I did 6 years of specializing in psychiatry, and I finished about 2 years ago.
Lauren, it's a really long journey. What was your main motivator to really stick it out, get through it, get to the end, and be a practicing psychiatrist?
So I went into it knowing I wanted to do psychiatry. So I had to go through the other stages, learning how to do surgery, learning lots of things that I felt a bit squeamish about as well, because I knew I needed to go through those to become a psychiatrist. A lot of people go into medicine and they don't know what specialty they want to do until it comes to it, and many people change their specialty as well. But for me, I always knew I wanted to do psychiatry. I found it very interesting, and I kind of felt at home when I finally got started in the psychiatry program.
What do you enjoy so much about your job?
I like that I'm getting to know people. I'm connecting with people on a one-to-one level. I feel very privileged because people talk to me about things that they don't talk to other people about. So it's a very privileged place to be. It's also a very important place to be. And every person is different. Every story is different. So my day is very varied. My week is very varied. There's also many other things you can do other than the clinical work. So my week is quite varied as well. I'm doing an MD Res, which is kind of like a PhD as well. So I'm doing some research. I do teaching. I do management work, service development work. So there are always different projects to be involved with that kind of spark my passion and keep me interested. And I like the feeling that I'm doing something to help people, be it that I'm prescribing medication that they find helpful, or just that sometimes people find it helpful just to have someone that seems to care to listen to them. Many people in society, they don't feel like they've had anyone to listen to them or care about them. So that's it's a wonderful kind of position to be in.
Lauren, and is that why you were drawn to helping migrants and immigrants and all your volunteering work and the work you do on that front?
Yeah, so when I went into medicine, I had this idea that, oh, I want to go abroad to with the Médecins Sans Frontières to war zones and places where I'm really needed and help people most at need in the world. And then I came to realize actually there are so many people right here in London who are really desperately in need. So there's no need for me to go elsewhere. I can help people right here at home, and it definitely, it seems that people who are asylum seekers or people with an uncertain immigration status who are really quite ostracized from society, they find it difficult to access healthcare, social care. They might be homeless. They might have gone through a lot of traumas.
Mm.
That actually, that was a group that I felt I could really, really help if I gave them my energy.
Lauren, and what do you feel are the top qualities that you have that you bring to the table that really serve you?
Um, so it's funny because some things that I see as qualities might also be seen as weaknesses at the same time. It depends on the situation. So um, I'm I don't tend to give up easily.
Mm.
I tend to speak out against the norm when I see something that's an injustice or I feel like something isn't fair or wrong. I tend to speak up about it. I've always been like that. In school, it got me into a lot of trouble. I used to get bullied in school because nobody likes the girl who kind of disagrees with everybody and starts, expressing views that other people might not agree with. But actually, that's, I think, been very important to get to where I am now because speaking up against against the norm and sticking to your beliefs while also being open-minded to other people's beliefs is really important.
Lauren, and you are a real expert on people suffering from insomnia. So give us some top tips for listeners who feel that they have real trouble sleeping. What do you tell them?
Yeah, so I think it's important to split this into two things. One is how can you get a good night's sleep, and the other question is if you already suffer from severe insomnia, what can you do about it? And I think it's important to think of that as two different questions, because actually someone who's generally a good sleeper doesn't need to follow the same rules as someone with insomnia.
Yeah.
So generally to get a good night's sleep, you need to get exercise. It doesn't affect you that day, but generally if you get exercise on a regular basis, it helps your sleep. There's a lot about blue light and screens. I mean, that's particularly important for adolescents, a bit maybe potentially less important for adults. Having a regular schedule, getting up at the same time every day, minimizing alcohol, other drugs, caffeine, things like that. And being able to kind of talk to someone about your worries, so you're not lying in bed thinking about them late at night. And there's a lot of things online about how to get a good night's sleep. I think that there's plenty of information about that. What there's not much support with actually is what to do if you already have severe insomnia. And many people go through insomnia for years, decades. And actually, there's very effective treatment for insomnia. Cognitive behavioural therapy for insomnia, it's called CBT for insomnia.
Yeah.
It's not like a regular type of therapy where you go and talk about all your problems. I mean, you can, but it's actually more like a sleep program, where or a sleep workshop. So it's often done in groups, sometimes one-to-one. And in that, you learn what are the reasons that I'm struggling to sleep, because insomnia, it's a psychological and behavioral disorder.
Mhm.
So it's impacted by how we think and it's impacted by what we do. So it's not just something that's, physical from the body. It's actually something that we can do something about by changing our thoughts and behaviors. So on those programs, that's what people learn. Now, CBT for insomnia is the gold standard treatment recommended by most countries, including England, the United Kingdom, recommended by NICE, which is the National Institute of Clinical Excellence. But unfortunately, it's just not available everywhere. I've written an article in the British Journal of General Practice about entitled "Why I think it's why insomnia needs to be given more importance." That's what it's called, and it kind of goes into why is insomnia important to treat, because it affects people in such a significant way. It affects our mental health, our well-being, what we can get done in the day, how we feel about ourselves, and then why is it not being given as much importance as other things?
Yeah.
like smoking, diet, diabetes. I mean, these things are all important, but actually insomnia contributes to a lot of these things. If you can't sleep well, it's going to be very hard to eat a healthy diet and go to the gym the next day. Um, so I go into sort of why that might be, and there's various reasons. I can't go into it all now, but I think just generally we don't value sleep enough as a society. And also in the past, people used to think that insomnia was caused by other things, like if it was caused by depression or it was caused by anxiety. Whereas now, and over the last sort of 10 to 15 years, there's been a lot of evidence from the research that yes, depression and anxiety can cause insomnia, but also insomnia can cause depression and anxiety. And actually, insomnia needs to be treated as a mental health condition in itself, not just as a byproduct. CBT for insomnia is highly effective. I mean, the research suggests it's between 70 and 90% effective. And in my experience, it's generally closer to the 90% effective, effective in 90% of people, I'd say. So it's very good. So what my recommendation would be is to speak to your healthcare provider, your general practitioner, about how you can be referred for CBT for insomnia. So if you're struggling to sleep chronically, by that we mean, more about half the week at least, it's been going on for at least a couple of months, it's affecting you in the daytime because you're feeling sleepy, or it's affecting your mood, then the gold standard treatment is CBT for insomnia. So I've been trying to do what I can to try and raise awareness locally and nationally about insomnia and this treatment, because there's a lot of evidence. We're not talking about something very niche here. We're talking about huge amount of research data that consistently shows that it's effective, even if someone has a comorbid pain, comorbid cancer, if they've got depression, PTSD, bipolar disorder, all sorts of other physical and mental health conditions alongside the insomnia, it's still effective. And actually it can improve the depression, the anxiety, or other mental disorders that go alongside it. So I've really been trying to raise awareness, because I think people need to know, and a lot of healthcare practitioners are just not aware of it. So I've been trying to kind of increase that awareness to make it, to get people to be referred more often and to make it more publicly available. It is available. I mean, there are national centres that treat it. So even if you're told, oh, my local area doesn't have this service, there are national centres that you can be referred to that do remote treatments as well on the NHS. So I would say to kind of push back if you're having that experience. But hopefully, as time goes on, there'll be more awareness and more treatment services available for this.
Lauren, I love that. And thank you for this amazing work. And thank you for mentioning it. And that gives me a lot of hope, because I hear about cases all the time. Lauren, I would love to touch with you on the mental health crisis that we face, not just in England, but really worldwide, and that there's a real happiness recession, and especially in girls. And so I would love to talk to you about that and what you have to say to that.
Yes, I mean, I think it's difficult to point to exactly what the mental health crisis is, or if it exists, when it started, because yes, there have been a huge number of increases in referrals to mental health services, increase in diagnoses. That can be partly that people's mental health is getting worse, or it can be that we're getting better at picking up mental illness.
Yeah.
And it's very difficult to say for sure which it is. I mean, during the pandemic, I think we were expecting people's mental health to get significantly worse.
Yeah.
Overall, that didn't really actually tend to happen. There were some people who got worse, there were some people who got better, but we didn't quite see this deterioration that we were expecting. Mm. I think overall, especially potentially in certain places in the world, and I mean, I can speak to London, where there's a huge amount of social problems going on, particularly housing crisis. And that's really impact. I mean, I see myself in my clinical practice, so many people who are referred to me with poor mental health, and the thing driving that poor mental health is the housing situation. And actually, as a doctor, I can refer for therapy or prescribe an antidepressant, but actually sometimes I don't, because sometimes what's actually needed is for me to try and support that person with the housing situation. Unfortunately, there's sometimes very little I can actually do, because there just isn't the social housing available, and what is available is often in very poor condition. But hopefully that will improve as time goes. We'll have to see. But I think that if mental health is getting worse, I would say that's a big contributor.
Yeah, it's interesting how all of these different areas play into each other. And sometimes actually, if you're responsible for the mental health, it actually has a different root cause and needs to be looked at from a different angle. Lauren, I'm wondering, what do you feel are the challenges that you face in your day-to-day?
I think that, so what I suppose one challenge is a self-made challenge, in that I try and do too much. That's also a blessing, because I love to be busy. I love to have different projects on the go that I'm passionate about. And I think that I deal with that just by sort of trying to keep a diary, trying to keep organized, trying to prioritize tasks. And I think the most important thing is to be enthusiastic about what you're doing. I think when you're passionate about what you're doing, you don't mind working late into the evening to do it. So I think that's the most important thing, is to make sure you're doing something that you actually feel, a drive towards. Another thing is I definitely do experience, and other female colleagues still definitely experience discrimination as a female. A lot of it is covert. It's not necessarily overt discrimination. The person discriminating probably isn't aware that they're discriminating. And this comes from all genders. It comes from women as well. And I think, especially as a new consultant, I look fairly young for my age as well. I was maybe, when I started, not really given the same level of respect as a male counterpart would have been given, or maybe someone who looks a bit older. It's tricky to deal with that. I don't have a lot of advice, except to, I think, point it out, when it happens, and speak to other people for advice. And one thing I really benefited from is that where I work, there's a group of women's consultants group, and we do meet up on a regular basis. And it's just nice to have that safe space to actually talk about these kinds of issues. So I would say just not to suffer in silence, and to talk to other people, because they're probably feeling similar things.
Yeah.
Hopefully, again, as we go through, that those things will gradually improve. Workplaces are now doing more awareness, doing talks, day sessions on this. So, but it will be a gradual process, I think, still.
It is, but it's great to talk about it, Lauren, because I think each of our stories contributes to a collective strength, and also to change a cultural narrative. So I'm happy that you talked about it. The more graceful conversations we have about all of these things, the more we can bring about change, because when we're honest, we can find solutions, and that's how change happens. I'm wondering, do you have any plans, goals, dreams for the next years?
So you know what, it's funny, a lot of times, in interviews and so on, I get asked the question, where do you see yourself in 5 to 10 years, or what are your ambitions for the future? My response is probably a bit different from other people's, in that I don't actually think to the future that much. I tend to live more in the present, and actually just I tend to be doing things that I'm passionate about, and because I'm doing things I'm passionate about, opportunities come along to do other things I'm passionate about, and one thing leads to another, and the projects get bigger and bigger and bigger. But I tend to focus on what I'm doing here and now, rather than what it's leading to, because I think if I'm enjoying it now, then wherever it's going, I'm going to enjoy that too.
Yeah.
And that's kind of quite an unusual response, and I don't know how well it comes across at interview, but it's the honest answer.
We love the honest answer, and we love that because it'll resonate. You know, everybody resonates with different things, and I think this is one thing that we don't do enough of. We're not present enough, enjoying the presence enough, and therefore we're always planning and dreaming, and then we're not here to really enjoy it enough. So thank you so much for that, Lauren, and thank you so much for talking to me today about your journey.
Thank you so much.